Okay, I would like to talk to you about disability that I chose was cerebral palsy. Idea of classification category: to meet the needs of the child with cerebral palsy, to achieve in an inclusive classroom, avoid hovering or protection, underestimating the child, and make sure that you don't limit engagement. Challenges that you can understand the child, you make sure that they can repeat themselves, but don't exclude them from that factor because they have this disability. Make sure you have a plan of action, lift and positioning and repositioning, move from place to place for that child in the wheelchair, and make sure that he could use it independently and be independent for himself. Accommodation, materials, and supplies. Books and class materials, of course, you want to make accessible for that child to utilize, and make sure that you have notes and copies of assignments, and that it is easily accessible. So strategically, the child scheduling time, you make sure you plan and transferring that child from one class to another, that you do it in enough time that the halls are not crowded. And of course, you want to make sure, back to accommodating material, that you have a set of books in the classroom and a set of books that the child can take home. You're accommodating him and his the disability. Common characteristics of cerebral palsy: it's a low incidence of disability, which is 6% less than the majority of disabilities. Children with CP have visual impairments, and they have problems hearing, speech, drooling, behavior problems, and learning disability. They need braces and wheelchairs and different things that could help accommodate these different characteristics of this disability. And they may have difficulty sitting, uncontrollable movements. In addition, they may use restrooms frequently, and seizures. Causes of disability of cerebral palsy is disruption neurologically, development in the brain. During birth, numerous situations are unknown, but gene mutation, this leads to abnormalities, and then material infections, growth of the fetus, fetal stroke, a break in blood supply, bleeding in the brain in the womb, infant's infection, inflammation surrounding brain, severe head trauma, and lack of oxygen. So instructional and behavior strategies to ameliorate the condition: assign seating. The child may choose the back of the room, but you want to assign a seat so you eliminate that factor. Instructional strategic things that you could do: instead of asking volunteers, select the children randomly to answer questions, provide and set up a group discussion, assign teammates. Expose the child to diversity, making the classroom accessible physically for that child. And then, there's some resources that you could use to read for the future, like creating an inclusive classroom. You don't want you want to study this so that you're effective for that child. It depends, his education depends on that. Conditions, stable progressiveness, and conditions in studying this disability. Information explains conditions present the birth, called congenital condition, and acquired conditions due to illness or accident. The importance of your communication with the parents and students, medically, psychologists, a psychological, provides education, liberties with special needs. So assistive technology devices for cerebral palsy, the number of types of disability with conditions: walking and hearing and difficulties in speaking, ability to communicate, hold a pencil, ranging from impairing quality of life and independence. This affects the health and social, emotional, and physical development. Needed technology would be electronic communication boards. This tablet is using special application programs, which gives the child opportunity to choose letters and words and numbers and pictures, and speech therapists can help them communicate with the board successfully. Low-tech communication boards. This will be using a pencil and paper to express, their communication successfully. If the child can hold a pencil. However, you can use this to clearly write and draw pictures, and using pictures that child can point or express himself when he has to, use the restroom, or if he doesn't understand the lesson. So speech generated devices, this allows the child to type words and sentences. This is only if he's able to use his hands, and then projects his speech that others can understand, and permits the child to communicate by auditory device. Eye tracking device. This is when a child has problems speaking, or the use of his extremities, hands, fingers, his arms, and this device follows the child's eye movement and tracking where the child is looking in a particular object or a particular word. Device can select without tapping on the surface, and it clearly can auditorily speak for that child based on what the child's eye movement was on. So hearing aids, in some cases, children have severe hearing problems. A cochlear implant is implanted underneath the surface of the skin. And this requires surgery, implanted beneath the skin. And that's an option that basically the parents would have to decide. Services that help with this exceptionality. Some cases, cerebral palsy combined with spina bifida may require additional services that may need utilizing, like the staff nurse, implementing additional help in your program to meet the academic needs and social needs of the staff. The school nurse. The nurse can help address medical challenges. Children with spina bifida may be relying on others to help them with their physical needs, but you want to have an inclusive classroom to be sure you foster, independence and socialization with the peers, because the children learn by the peers. Needing occupational therapy, OT and physical therapy, PT, each therapist during school hours. Thank you.